one observation that we have made for sure over the last couple of years is, right to your point, is we've been talking about AI for a long time, generative AI. What kind of impact is it going to have in the marketplace? And sadly, over the last 3 years or so, you've seen a lot more talk than you have seen action. But this last year or so, you've actually seen some implementations for automation, AI, things that you've described that they're real now, which is fantastic. One of the things I think we still need to get through a barrier without getting into a deep conversation regarding AI is really the adoption of it, right? So there's some skeptics who are still out there. With any new technology, new platform, et cetera, you're going to get those naysayers who are going to, kind of push back on change, things like that. But I think, what I've observed anyway, especially with folks like yourself and Mittal and others who are more progressive, that they've made this work, and they made it work in a way that disarms folks, right? But to that point, there's still challenges when you're talking about, getting the adoption and then getting a level of satisfaction, from the technology and making sure it's leveraged correctly, that they're comfortable with it, that it's getting the outcomes that you want. So Andrew, back to you, since the transition of Mittal, what has the response been from the surgeon offices themselves?
Surgeon offices, I think we can be honest, back in when we were starting to onboard the offices in 2018, there was a lot of anxiety, change management. It's what we do all day, every day, was critical to this. And I do have to give, a lot of credit to Harold and his team, because it was shoulder to shoulder support, ensuring to make sure that the office schedulers felt confident with the platform, were able to customize it for their surgeons in terms of what their workflows are, if they're doing a total knee or total hip, what their favorites are. So a lot of things could be pre-populated. And clearly, the numbers that we were hearing was that it was taking on average about 9 minutes to book a patient for surgery. And that was numbers, maybe others may challenge me on that, but about 9 minutes to book a case in terms of filling out paperwork manually or printing it out and getting it faxed over and all that. And this brought it down to about 2 minutes and 30 seconds in order for them to be able to do that, because there were a lot of things able to be I would say favorites, not necessarily pre-populated, but favorites to be able to then customize it for the surgeon and then for the specific patient. So first couple of months, certainly, managing through that change and getting away from the fax machines and the old ways were challenging. But 7 years through, every single office that we work with likes the system, is happy with the system, appreciates the efficiency, appreciates the two-way communication, and ultimately has made their jobs more efficient for them to be able to do more themselves as well. So overall, very positive feedback.
So it sounds like they'd be kicking and screaming if you try to take that tool away at this point, now that they've made the transition. That's great. So Kim, back to you. So what are some of the direct benefits that you've been able to tie directly to this initiative? So more along the lines of the outcomes and benefits.
It's improved patient safety. It saves time. The patients, the pre-admission testing department, the surgeon's offices are no longer scrambling at the last minute for clearances. Patients, no longer have to go see their cardiologist the day before surgery. Another benefit was that pages were mixed up with other pages of other patient information. Now we see things in their entirety. It's within the first month, we decreased our case cancellation rate by 65%.
Wow.
And improved our case completion bookings. We're at 92%.
Wow.
So within the first month, we saw huge benefits. Huge.
That is quite significant. And so, Andrew, same question to you. What were the most valuable benefits for Hartford?
I think for us, it was really providing a standardized and streamlined process in order to ensure that we're reducing variability. If we're able to reduce variability, the outcomes, your patient safety, the quality and the experience is going to be improved across the entire spectrum of care that we're delivering day in and day out. And although this certainly was an investment for us to be able to do this, the outcome has been the absolutely tremendous quality that's being delivered to the patients daily, and ultimately the experience for all stakeholders. in doing so.
One of the things that was brought up before when I was speaking to, I think it was last week, you were talking about the impact that it has on rev cycle management. So I was wondering, like, how has Mittal been able to help with your rev cycle management and prior authorization process?
So with the prior authorization process, this is actually something that I just did more recently. Just strictly giving visibility to our financial clearance and verification team has helped tremendously in ensuring that the appropriate and right prior authorizations in place, as well as the appropriate designation for inpatient or outpatient is in place as well. So that's one piece that, again, we're talking within the last year, we actually started to implement that to help us with that, because we were seeing denial rates increase. So that has helped. The other way that it can help rev cycle is the fact that you can customize, as Harold was saying, based on your guidelines, creating rules and hard stops within the actual platform. And we've tested this out, and this would have to be very specific for whichever entity wanted to use this. But in orthopedics in particular, there are specific thresholds for patient safety, BMI, hemoglobin A1C levels, things like that you can build into this, that if you are over a certain threshold of what your guidelines state, it could be a hard stop that it cannot proceed until you actually have, either medical director approval, or at least there's a conversation of why maybe does an exception need to happen here. So it does provide those type of rules in that place. But along the same lines, when it comes to choosing implants and choosing what you are going to be doing for surgery, based on analytics and based on what's behind the scenes within the platform, it also can make suggestions, not hard stops, but suggestions, and maybe to be able to utilize a different type of implant and or potentially a cheaper one if it's appropriate. But that's all customizable, which I think is really nice. You don't have to do it. You can utilize it if you want, but in terms of being able to help in some of those rev cycle opportunities, those are certainly some of the ways.
Yeah, and is the rules engine that you mentioned, you can personalize it and customize it, et cetera. Is that something that you guys do directly, or is that something that Mittal does on your behalf, or is it a combination of the two working together?
It's a combination of two working together. It's a combination of the actual clinical guidelines and protocols are created through our medical advisory board by our surgeons, who through a multidisciplinary team to really ensure that best practice, evidence-based practice is being delivered. And then in working with what develops out of that, working with Mittal to be able to create that behind the scenes within the platform.
Excellent. Okay. Thanks for that insight. Kim, I'm going to go back to you, and I'm going to stick on the rules engine here for a moment. So you've mentioned earlier about CMS inpatient rule. We didn't really dive into it much, but it sounded like this was a pre-existing issue that you had at your organization. So how has Mittal helped you improve your CMS inpatient only process, and how does that work?
There's a dashboard that's created that the insurance verifiers see, the schedulers see, and the surgical offices see. So the surgical offices will see when they're booking the case, if it's an inpatient only code, it will alert them. So the case is booked correctly. It can't be missed. It can't be booked incorrectly. That's a hard and fast stop.
Excellent. And what happens, for those who aren't as familiar, what happens if there wasn't a stop? What happened without Mittal, in other words?
Unfortunately, before we implemented Mittal, we did have some inpatient only procedures that were booked incorrectly, and we were not reimbursed for those cases, even after we tried to appeal them.
Right. So you basically did the procedure, you weren't in the right venue, so then you just didn't get reimbursed, even though that you tried to go back and appeal that.
Exactly.
No, so that could be pretty costly. I want to transition back to Harold here. So we've learned a lot about current functionality. Deepak mentioned some new technologies generally in the space. I know that you guys are always looking ahead, like what's next, what's on our roadmap, et cetera. So Howard, what exciting upgrades can we expect from Mittal over the next couple of years?
Yeah, and thank you for that question, Lawrence. Well, the last 12 months, I will say, has been absolutely game-changing for us. And why I would say that is, obviously the ability for technology to catch up now, whether it's through artificial intelligence, natural language processing, RPA, robotic process automation. All of those help our client partners yield a reduction in administrative burdens, quicker and streamlined implementations. Why I'm mentioning that, though, is that the beauty of this technology and the advances of the technology will help us refocus our attention away from technology and onto the patient. We know that physicians are burning out, staff is burning out. So what we're finding, and certainly we'll be announcing several exciting portfolio extensions in the near future, is how we're leveraging, whether it's AI, NLP, to surface issues within workflows so that the administrative burden of being attached to or fixed to the EHR will be significantly reduced.
Gotcha. Pretty exciting stuff coming.
I mean, it's like I said, it's been game changing for us. Just to give you an idea, we talk about PDFs, for example, right? The fax machine. Unfortunately, in healthcare, PDFs may never go away. But our ability to leverage natural language processing and other technologies to canvas those clinical documents and make sure that we're arming folks with the information that they need much earlier in the process has been, like I said, it's been game changing, whether it's anesthesia, prior auth, whoever it is, that's part of that surgical ecosystem.
Excellent. I want to switch over to Deepak now. So Deepak, Harold outlined some pretty exciting new technology upgrades coming to their platform. I want you to think about things even a little bit more broadly from the chair that you sit in, like having a broad spectrum view of the market and deep understanding of AI and other advanced technologies. What can we maybe extend off of the last time we chatted is what else can we expect next in healthcare technology?
So it's an interesting question from the perspective that in my opinion, there are two business trends which are actually driving the technology trends and innovation in healthcare. The first one is actually thinking outside the organization itself and thinking ecosystem. Mm-hmm. What that really means is that now the data ecosystem and the ecosystem AI, which is basically using the data of not only your organization, but also your partners and vendors, mm-hmm. is actually coming into place. And Larry, we basically talked even in one of the previous event, Mayo Clinic actually came up with the data ecosystem, which is actually have 37 healthcare systems part of it, which is actually allowing the tools, AI and technology to be able to bring the value which wasn't there before available as an ecosystem. And in my opinion, the OR data, when it is actually connected with the vendors, partners data, overall, there will be a lot of value for the whole ecosystem, and which can be actually shared across as well. Secondly, in my opinion, I basically believe that let's not reinvent the wheel. What I mean by that is we have to learn from the other industries, and that's a trend which is going on. Mm-hmm. Operation OR efficiency and other efficiencies, neither it is unique nor new. For actually means I did my industrial engineering, master's in industrial engineering, so I've been seeing the efficiency, how it is going. And in my opinion, manufacturing organization are actually far ahead in terms of when it comes to operations efficiency. And one of the technology which they are actually using is called digital twin, and digital twin is helping these organizations to actually run the simulations to come up with the best optimal answers for the what if scenarios. It is also even telling them that, okay, not you should follow these guidelines, but also helping them that you should change your standard operating procedure and guidelines in this fashion from an operating, from efficiency perspective. And I think that is some of those technologies, which if we will look at a little bit outside the healthcare, we will find very good use cases and we can actually bring those. And I would like to add just one more point to you mentioned about the change management. I basically believe that the first business trend, which I mentioned about the data ecosystem, is actually going to bring the trust and minimize the risk. So from a technology perspective, when we will bring that trust, which is evidence-based, when we can actually say that, okay, the data bias is not there, all the cases are improved, and then to say this is actually the result, and not only on your healthcare system, but in 37 healthcare systems, when that data has been run on a wider data set, you will find that the trust and risk will be much more manageable, and the change management will be much more easy as well.
Great perspective, and you're right. I think healthcare tends to lag behind in technology. FinTech and some others seem to run with it, supply chain. So we can definitely learn and benchmark off of what they're doing. I completely agree with you. But thank you for those insights. Now I'm going to move on. This will be the last questions for Andrew and Kim and before we switch over to the Q&A. So we have gotten some questions from the audience. I want to leave enough time to be able to answer that for folks. But so Andrew, I'll start with you. Please give us your advice for health systems that are struggling with inefficiencies in the OR. Where do they start their journey to overcome those challenges?
I think it's looking at what your current technology is that you have in-house and where you are able to leverage current platforms that you have, but being open-minded and understanding and appreciation that sometimes it may not be there and or the full picture of what you're looking for. I give the one example where I have yet to find a solution around the vendor communication component, all built into one complexity with the fact that you can book a case and it's going to the vendor, and there's communication with our sterile processing department, communication with the para department. There are and have been a lot of solutions out there that can do a lot of those individual pieces, but bringing it all together, I think that's really important. And in terms of my recommendation is really do the research and try to create those opportunities with potentially outside and or third party entities to be able to create the solution that you need to be able to drive that efficiency. Gotcha.
Thank you for that advice. Kim, same exact question over to you. So I'll restate it just so you can remember, but please give us your advice for health systems that are struggling with inefficiencies in the OR. Where should they start their journey?
Identifying your issues, what your biggest issue is. Ours was to get rid of faxing. And our IT department was busy, so we were looking for a cloud-based system. And our experience with SurgiScript and Mittal has been nothing except top-notch. They're very easy to work with. They're responsive, very supportive. We had weekly meetings. They stood hand in hand with us. They went out to the surgical offices and trained them. We still have meetings. We have monthly meetings with the surgical offices. They are a partner with us on those meetings. If we're adding new surgeons, new procedures, if the surgical offices are adding new staff, they're right there to train them, to add the new procedures. It's just been an awesome partnership, and we've had huge results from it.
Yeah, and from the content that you just provided, you hit it on the head. It sounds much more like a partnership than it does a vendor-customer relationship, right? Which I think is huge moving forward, is being able to trust and work together to solve problems, right? It sounds like you guys have found that in a partner, so it's fantastic. So we have got a number of questions from the audience. As far as looking down at my phone, I'm getting texts of the questions that are in chat. I'm going to start, though, with the question that I know that comes up a lot. Obviously, you guys are on systems, you're on Meditech, you're on Epic. Integration's key in a lot of cases, depending upon what it is exactly that you're doing for workflows, et cetera. So I'm going to point this question at Andrew and Harold. If you want to jump in after Andrew, feel free to do that. But how has experience been with integrating Mittal with your EHR?
So from my perspective, we did not integrate for the first few years. We did integrate recently in the last two and a half years. The short answer is yes, it can integrate. The short answer is when you do integrate, it does become more of a seamless process than if you don't integrate. But I'll turn it to Harold in terms of the specifics and details of kind of the behind the scenes and the IT component of that. But the short answer is it can integrate and it's been helpful.
And Harold, when you respond, thank you, Andrew. When you respond, can you also address that they were operating obviously very efficiently without integration for a while, and then get into the actual process of integration?
Right. So without integration, what we want to do is take a disparate process where we're bridging a gap from any surgical office. So in these particular instances, they were not only private surgical offices, but also employed. And we're taking two distinct different groups and creating one systematic process where the handoff to the OR was robust and complete with the clinical, financial, and operational requirements based on their guidelines. It functions beautifully that way. It certainly is ideal to integrate, but we know sometimes there's a more critical or a burning platform to get started even before IT goes, and it seems to be well tolerated. And I think one of the things that we're most proud of is adoption by all the stakeholders. So even when they're using Epic or they're using Meditech or Cerner, their ability to complement and strengthen the data that comes into Epic without integration is a big win for them. With integration, whether it's Epic, Cerner, or Meditech, it works very well, and it's a pretty predictable, reliable process for us to integrate. It does take resources on the hospital or the surgical center side, but they're typically very capable of integrating. It's just a matter of when they want to put us in the queue. And typically we'll see the queue sometimes back off or back up a little bit just because it's working well without integration.
Gotcha. And yeah, I have heard that a number of occasions. I've heard from customers that just said it's working great even without the integration. We can get some other folks in line that need the integration because the workflows are just going to be broken until that happens. So it's great that you guys have that flexibility, the ability to work with and without integration. So that's great. I got some other questions here that were really good from the audience. This one I believe would be directed at Andrew and Kim. Any best practices onboarding new surgeon offices? What would you do to help ease their concern when you're transitioning to a new platform? And that's a big one. So Andrew, why don't you start and we'll go to Kim too.
Yeah, sure. I mean, I think for us, it was the proof in the pudding with, when we initially launched it, there have been new offices, there have been new providers, there have been new procedures. Where I really think it is, and again, this goes for Mittal, if this goes for any other vendor, is that has to be a very big piece of when you're vetting these partners into ensuring that they're going to be able to commit that shoulder to shoulder, not a hotline that they're calling, it's a shoulder to shoulder support of really being able to embrace that. So from us, from historical precedents, I was able to give my word. I mean, just literally give my word that I am confident that our partner in Mittal would be able to deliver this, and it has been seamless from that way on.
Gotcha. And Kim, same question to you.
I mean, there was anxiety, when we were launching this and everything from the offices, but the offices are in love with it. And as we have onboarded new surgeons, they have experience with Mittal already from other facilities that they may work at.
Oh, understood. So you've got some of your staff already had some familiarity with it, and others had to get familiar with it. So
yes.
So basically, it sounds like once they kind of see what it does and the ease of use and the UI, et cetera, then it seems like that's an easy, it wasn't a big pushback. It sounds like at your organization.
Exactly. And the first time they meet any of the implementation team and they go out for training, their minds are put at ease to see how easy it is and what a time saver it is for them to now book surgical cases.
Understood. So between the two of you, I mean, it's you guys have done a great job. Obviously, any kind of new technology that you need to implement, you're always going to get change management, pushback, et cetera. But it sounds like you guys have really nailed it. So thank you for that, and thank you for the advice. I'm sure that's very helpful for folks on the line. Another question. What is the best way to reduce operating costs without compromising your patient care? So go back to you with that, Andy.
Obviously, I think one of the biggest components is to really be looking at the entire spectrum of care for you not to have inefficiencies, in the process. And again, going back to just this whole conversation, if you're able to become more efficient, you're able to have that actual value at the end of the day be much more significant. So from a same-day cancellation, first case on time start, if you're prepared for that and you can start on time, you're already ahead of the eight ball, being able to then, delaying your second, your third, your fourth case. Ultimately, with efficiency, you're able to do more. And I think that's one of the big reasons of which we've been able to grow between the two hospitals. When we started this program of doing 1,000 to 1,500 cases to doing almost 9,000 cases annually, because we've been able to leverage the efficiency. From a cost of care perspective, I do think in this day and age that we live in, it is so important to have strong contract management with your suppliers and your vendors, and ensuring that you are getting, very fair pricing and contracting on your end to ensure that, you're able to then leverage those savings to the patients themselves. So that's, those would be my words for that.
Excellent. And Kim, I'm going to have you have the last word here. So same question to you. If you can, what is the best way to reduce operating costs without compromising patient care?
Exactly what Andrew said, becoming more efficient, being able to add cases on. I'm happy to say that every year we've been able to grow OR volume 3% over what we have budgeted.
Wow.
Right. It's just made us more efficient. We're able to do more cases. We decrease case cancellation. It's been a win-win for us.
One thing that I keep hearing from both of you, but from others, customers in Mittal, is really the fact that this efficiency allows you to gain time back, allows you to focus on the patient and really have them the center of your attention rather than have the systems do it. So that is a common theme that I think is really important for everyone. Those are the questions for today. So I just want to really big thank you, Andrew. Thank you, Kim, especially for your journey, sharing with us your transformation from the inefficiencies that you're experiencing there, which I know is across the entire healthcare landscape, right? So what you guys have shared today, I think, is very valuable to everybody else, because I know there's plenty of folks out there just trying to figure out, how do I get more efficient? And I think not only did you talk about the platform and what you're doing there, but you're also giving them good advice on transitioning where you were and how you got there, and some advice on how to get adoption. It's been fantastic. So thank you, Deepak. Thank you, Harold. You guys were wonderful with adding color to the conversation, being able to really give us some projection on what cool things are coming down the pike pretty soon, especially for the Mittal platform. Very exciting things there. And Deepak, always great to level set with you on where technology is and how it's going to impact healthcare and what to look forward and what to forecast coming. So overall, very successful.